Mr. Speaker, before I start, I want to thank the many autism charities, mental health charities and research groups that have reached out to me over the past few weeks. I will indeed.
I thank her for giving way so early on in the debate. Will she join me in thanking the whole Autism family, a charity run by Anne-Marie and Martin Kilgallen in my constituency, who have 2 autistic boys who do so much to support other families who find it difficult sometimes to access medical and other healthcare.
Yeah.
I thank the Honourable Lady for her very important words. Yes, I think the bedrock of much of the work that is undertaken right across the United Kingdom is based in small charities, those who have personal experience and those who know what works and what needs to be done. The level of interest in this debate clearly shows this issue's importance. It's important to so many right across the United Kingdom, to some of the charities that we have already heard named, and also to charities who have contacted myself, including Autistica, the British Autistic Society, Royal College of Psychiatrists and the British Psychological Society, who have all contacted me regarding important recommendations. Yes, I will indeed.
I thank the Honourable Lady for giving way and congratulate her on getting this debate. Would you agree with me in congratulating some of the women in Coventry, a women's organisation in Coventry, who are very much involved in mental health issues amongst young people and older people, but in particular the omission of any help they can get, because very often they act as carers, and the government should do something about that and give proper grants to those organisations.
Dr. Lee.
Indeed, I think that is an extremely important point, and I think we have to ensure that when we consider particularly young people with autistic spectrum disorder, that often we're thinking about a family systemic approach, and that carers are at the forefront of providing support, and they need the best resources possible. I also want to thank the many citizens actually from across these aisles who have been in contact with me to give their own poignant personal accounts. These accounts have been harrowing to read and more harrowing for them to experience. I think it makes us realise just how absolutely vital this debate and this issue is. I want to extend a personal warm welcome to the youth patrons up in the gallery today representing Ambitious About Autism. Their recent campaign and research project, Know You're Normal, has been helping so many people and raising important awareness. And finally, I wanted to give a specific thanks to the MP from South Cambridgeshire and the MP from Cheshire and Amersham, who have worked tremendously hard on this debate and for people with autistic spectrum disorder through the all-party parliamentary group over many, many years. As a psychologist, Mr Deputy Speaker, I can tell you that when it comes to autism and mental health, that progress has been made over many years since I started in 1990, when waiting lists were extremely long, almost possibly a year or over, and when services were very, very limited. However, much more must be done right across the United Kingdom. Indeed, I will.
I accept the point the Honourable Lady is making, but can I tell you that to tell the Honourable Lady that in Durham, waiting lists are still 2 years long?
That is an excellent point, and it's clearly unacceptable. We are initiating right across the United Kingdom, Scottish Government and the United Kingdom Government, waiting times initiatives, but I think what we're finding is that the experience at the front line, the experience on the ground for families, for young people with autism, actually right across the lifespan, is that despite the waiting list initiatives and the waiting times that are expected to be in place, that's not the reality for people, and therefore we need to be addressing that quite seriously.
Would she give way?
I will indeed.
She's been very generous, and I'm grateful to her for giving way. Does she also agree, though, that often mental health issues for adults with autism can arise out of the way that they're treated when they encounter the criminal justice system in society, and that sometimes behaviours that come along with this condition and with autism can be misinterpreted by people in the criminal justice system? Does she agree it's important, therefore, that not only do we get the health provision right, but make sure that people within the criminal justice system understand about autism and take that into account when they meet adults with autism?
Yes, I absolutely wholeheartedly agree with that point. I actually have personal clinical experience of that through working across a variety of secure hospitals and prisons in my own practice with the NHS. And I think that you make such a good point in relation to the criminal justice system, because often people with autistic spectrum disorder find themselves caught up in the criminal justice system, which has little awareness of their needs and the supports that they require, and therefore when they get caught up in the system, it's very, very difficult for them to then move on and rehabilitate, because the provision is not just there. I will indeed.
I thank the Honourable Lady, and she's been very generous. Just to follow on from my Honourable friend's point, there is an argument that says that police lack training to handle some of these young people when they don't understand what the nature of their mental illness is. Don't you agree with me that something should be done about that to give the police some sort of training there?
I would agree with the Honourable Gentleman's point. I think our police services are on the front line. They deserve the utmost of respect for the work that they do. But yes, it is correct to say that they require further training, but also further support. And there requires to be a clear pathway when people do exhibit challenging behaviours in the community, from the system where the police may be put into contact with them, through to adequate supports in the health system without being caught up in a criminal justice system in between. Yes.
The lady well on that point.
I will indeed.
The Honourable Lady will be aware that the societal body that is more likely to come in contact with someone who is potentially going to take their own life are in fact the police. And the police are doing really quite critical work in both, particularly British Transport Police, to look at how staff can be trained to identify potential suicides and to take action, to take people back at a time of crisis in their life to prevent them actually taking forward a suicide. I don't think we should knock the police too much. They're doing fantastic work in this area.
Yes, I absolutely wholeheartedly agree. I think, as I said initially, the police are at the front line. They are facing the very crux of the matter when it comes to life or death situations, and they are doing the very best with the resources and the training that they have. It does, however, in my opinion, require to be a clearer pathway so that people who are at that crisis stage can then access health services and probably crisis health services at that critical stage, so that the police have somewhere to ensure that their clinical needs are met, because it's unfair for our police to have to take care of people's clinical needs when that's not what their training provides. If I can just make some progress. In 2016, an academic study in Sweden published in the British Journal of Psychiatry found that people with autistic spectrum disorder were 9 times more likely to die by suicide than the rest of the population. Now the latest research is indicating that people with autistic spectrum disorder account for a harrowing proportion of total suicides here in the UK. There is in fact a 16-year age gap in life expectancy between people with autistic spectrum disorder and the general population. To put this all very bluntly, people with autistic spectrum disorder are 28 times more likely to consider suicide than the average population. 28 times. These statistics make one thing abundantly clear. What we are doing now to support people with autistic spectrum disorder is not working, it is not enough. We know from research that people with autistic spectrum disorder, almost 7 out of 10, experience mental health issues, including anxiety and depression. We have to have services in place which ensure that people are cared for holistically, that we meet all of their clinical needs. That might be their autism, it may also be learning difficulties, but it will also most certainly be mental health issues. And quite frankly, today we don't have services in place that account for the complexity of the needs presented with. So what types of things are going wrong for people at the front line? Firstly, it is very difficult for people with autistic spectrum disorder to access mental health supports through the usual routes. For most of us, this might be going to the GP as a first point of contact through primary care for mental health problems. But GP practices are a daunting and unfamiliar place for people with autistic spectrum disorder. One young man wrote to me and described a recent trip. It was quite hard to access the GP anyway. Getting through on the phone was extremely difficult. The whole environment when I got there was more difficult. It was noisy, it was very hot. There was a loud beep when they called the next person, and I actually found that quite painful. When I was feeling emotionally poorly, that became almost impossible. So GP surgeries make reasonable adjustments for wheelchair users every day, simple changes that make the life of these patients easier. I would request that the same policies are implemented for people with autistic spectrum disorder, reasonable adjustments. We need training to raise the awareness of GPs. We need to have easier access to the service. We need to make sure that GPs know who is on their register who has a diagnosis of autistic spectrum disorder. If someone with autistic spectrum disorder bypasses their general practitioner and tries to go straight to mental health services, they may face unprecedented waiting times, or they may simply be refused treatment. When individuals do attend services, sometimes they find that they get to the service, but then they're discharged without any follow-up. Last week at the Health Select Committee, we heard how a young autistic boy was turned away by child and adolescent mental health services 4 times, despite feeling suicidal because he hadn't yet attempted to take his own life. Now, this is extremely important. Things have hit a crisis point. We need to be making sure that we engage in prevention, and that attempting to take your own life isn't the point at which you receive treatment, that early intervention and pinpointing the symptoms of difficulty are where we should be aiming for treatment. Yes, I will give way to the Honourable Lady.
And I thank the Honourable Member for kind of giving way and for securing this very, very, very important debate. She and I sit on the Health Select Committee, and it was at the Select Committee inquiry into suicide prevention where we heard the point at which someone is most likely to take their life, most tragically, is when they are discharged from inpatient care. And the Select Committee's recommendation was that everyone should be contacted within at least 3 days, and we're waiting for a response from government to that very particular point. Does she, like I believe, that everything should be done to ensure that those people most vulnerable, including the very people we're talking about today, people with autistic spectrum disorder, should be supported in that extremely vulnerable period to ensure that they don't take their life?
Yes, indeed, I do. I think that that's an extremely valid point. I think it's very important that when people arrive at A&E for crisis intervention, if they are admitted for a period of time, that they're discharged with some follow-up, because often people are going back to the same circumstances that led to the difficulties in the first place, and if they don't have some support to deal with those extremely difficult circumstances, then they may be placed in a very vulnerable situation and try to self-harm or to harm their own life once again. If someone with autistic spectrum disorder feels unable to go to the GP or unable to reach out to services in place in the local community, they might try to ring a suicide helpline. However, that can be extremely difficult in itself for someone who has autistic spectrum disorder, who finds communication difficult, who finds social interaction difficult, who may only be able to verbalise some of their difficulties, and who may then find that there's no follow-up from that service either. So what I'm saying is that at the early access point, at the crucial time where early intervention, when prevention of suicide, when we can prevent mental health problems from being exacerbated, at that extremely critical early intervention stage, much more has to be done to ensure access to services. If someone with autistic spectrum disorder does reach a health professional, they can often find that their mental health problems are overlooked or misdiagnosed, and that might be because they present in an extremely complex case. They may also have concomitant learning difficulties. They may not present in terms of the symptomatology you would usually expect for anxiety or depression per se, because their symptoms are complicated by their autistic spectrum disorder itself. So it is extremely important that mental health practitioners have training in autistic spectrum disorder in the types of presentations that they might need to try to identify, and particularly in terms of risk issues. Diagnosis, Madam Deputy Speaker, I must say is still a postcode lottery. I've requested previously, and I hope to continue to work with the Minister in this issue, because we need to have an understanding of who is appropriately trained in diagnosis of autistic spectrum disorder, which level of specialty do we have in different types of professions, what is the workforce plan to make sure that this very great need is addressed across our society. It's so important. People with autistic spectrum disorder say they don't know where to go locally. When I ask that of services in the Health Select Committee, they say, well, we don't really have a map of who can diagnose, who can provide specialist intervention at which area of NHS England. And I think that that's something that would just streamline services and make it so much easier for people to gain that initial access. I don't want to take up all of the time of the debate today, so I'm going to provide a brief overview and let other people speak, because I know there are so many people who today want to contribute to this very important debate, but I do wish to touch on another few important issues. The next one is mental health therapies and access to mental health therapies. What I would do is request that the Minister has a look at what works specifically for people who have autistic spectrum disorder and those who have concomitant mental health difficulties. I don't think there's an adequate research base there as yet. I think that's something that, as we know, is so critical, it's life-saving, that it's something that we really need to prioritise in terms of funding. Traditional mental health therapies might not work in the same way for people with autistic spectrum disorders. If I or you presented at a GP surgery, we may be offered cognitive behaviour therapy, but we don't know if that is the best option for someone who has autistic spectrum disorder, or if some kind of adapted therapy would be more appropriate. So I think that's really, really important work that should be undertaken and actually undertaken quickly in order to engage people in appropriate therapies and save lives. I wanted to speak about a couple of the individuals who had contacted me whose own poignant accounts really struck me. One of them was an individual from my own constituency who said that she has continually tried to contact services to have access to services, once again CAM services for her daughter, and her daughter has been repeatedly self-harming. Now, that has placed the family in such a stressful situation over a lengthy period of time that the family themselves and the mother, and I think we mentioned carers earlier on, are now feeling that their own mental health is under stress. So what I would say is it's extremely important, not just for the individual in the system, but also in terms of making sure we preserve family life, that we can support carers, that we can support families, and that we're not actually then placing an additional burden upon the NHS and services, because families and parents will go on to develop their own depression and anxiety when dealing with an intractable situation. They don't know how to cope, and if we don't address the problem at its root, then it's multiplying the problem for services right across the UK. I will indeed.
I thank the Honourable Lady. As I said earlier, she's been very generous. Coming on to the point about carers, I mean, I met a number of carers some months ago, and one of the things that struck me from time to time, they were extremely distressed. Some of them couldn't afford a holiday, and remember this, at the end of the day, they don't get very much help, to say the least, about that. They're not even paid as carers. So there's an effect, a mental health effect on the carers sometimes as well.
That's exactly the point I'm making. What we're doing is exacerbating the problem for families, and actually families are at very grave risk, placed under significant stresses over periods of time to have their own difficulties in terms of mental health issues or perhaps separations, things that could have been avoided if supports were put in at an early stage, and we could have addressed the difficulties and given them the help that they need. The other case that really struck me this week was an individual who contacted me just last night to say that they hoped that this debate would make a difference, because they had been struggling for a long time to access services for their daughter, who had been self-harming over many years and who only in the past few weeks had tried to throw themselves out onto a dual carriageway under a number of cars, just feeling at crisis point, at breaking point, feeling isolated, having a lack of peer support, having a lack of clinical help at the time of need. And this individual had been discharged from CAMHS a number of times after referral for assessment. So what I would ask of the Minister is that I understand that if an individual comes to a CAMHS service and perhaps they don't fit a diagnosis, initially it can be difficult to think of the types of services or follow-up they need, and they may be discharged. But that has to be looked at, because young people in this situation have grave clinical need. They might not fit a clinical box or a diagnostic box, but they do have clinical needs that require to be followed up. And these young individuals are falling through the gaps, and quite literally, this family was concerned that their young person would be falling under a car and they would be losing them for good. That just cannot be something that we allow to happen in today's society. And as I say, it's such a critical issue. It's life-saving if the Minister can show the leadership that we need today. The 5-year forward view for mental health recommends that the NHS England should develop a referral to treatment pathway for people with autistic spectrum disorder. That would be a vital step. It's too complicated. People don't know where to access services. They don't know where to go. Even services themselves don't know the best route forward for people after they present. So this has to be streamlined, and I think we need to see progress in this regard. What we need to also do, though, is, and it's been mentioned here already, is we need to look not just at children with autistic spectrum disorder, but across the lifespan at adults too. It's so important that adults who may have autistic spectrum disorder have access to a diagnosis in the first place, but also if they present with mental health issues, that they're able to receive the support that they need. So this is really a care pathway that has to straddle the lifespan, so that none of our constituents right across the UK fall through these gaps. It would be important to ensure that GP registers, which are recommended by NICE, where individuals with autism are highlighted to GPs on the register so that they can signpost them to correct supports are undertaken. I think that that's an extremely important issue, and last time this issue was debated, the Minister at the time said they were open to these suggestions about the registers, and it would be important to hear an update on that today. The Scottish Government has launched its own Scottish Strategy for Autism in 2011, declaring autism as a national priority. I would concur with that. I think it is a national priority. But this means more than simply diagnosing autism. It means that we must think about people with autistic spectrum disorder right across our communities, their access to services, their access to community services, shopping centres, their access to society at large. So this is bigger than health itself, and I'd like to know how the Minister is going to liaise with other departments to make sure that we don't leave people with autism behind, and to ensure that this is embedded into all of government policy. I have certainly written to the Scottish Government to ask for their update too, because the policy, and I've read the policy thoroughly, is an extremely good policy, but I'm still finding constituents contact me to say that on the ground, in terms of implementation, they are having the same difficulties accessing services, and that things are not working in the way that they should. So it's something that we can perhaps work together on with the Scottish Government, with the Welsh Government and with the UK Government, to ensure that best practice is in place for people with autism right across the United Kingdom. In concluding, Madam Deputy Speaker, I really hope that the Minister will listen to some of the recommendations today. Others from across this House will have extremely important accounts to give. I want to welcome all of the accounts and the interventions that we've had today. It's a concerning issue, it's a vital issue, and it's important that we work together cross-party to ensure that people with autistic spectrum disorder and mental health problems don't fall through the gaps, but have the services that they deserve. Thank you.
To start.